Morning, children. Today we are going to discuss about some more disorders of the heart, that is angina pectoris. We are discussing about angina pectoris. So it is also very important concept in this chapter. So we discussed about heart stroke, okay, and what you called brain related problem, that all we discussed in this what you called chapter, right? So next concept, next problem of the or next disorder of the circulatory system is angina pectoris. What is that one? Angina pectoris. What is this angina pectoris? That one we are going to discuss. Okay. So what are the problems? What are the symptoms? Why this problem will come? Why this disease disorder will be there? What kind of problems will be there? Like that we will discuss in this video. Okay. Previous class we discussed about what? We discussed about the stroke. We discussed about the hypertension. Okay. And before that, regulation of cardiac activity and what you called different double circuit circulation, ECG, like that we discussed. Now the angina pectoris. Okay, so first it is the ischemic pain in the heart muscles. What you call ischemic pain? So sudden, okay, severe problem is experienced during early stage of coronary heart disease. Early stage of coronary heart disease, not a complete a long prolonged period after, not, it's early stage of the heart disease. Okay, so atherema may partially block the coronary artery and reduce the blood supply to the heart. You know atherema, you know very well. Cholesterol may partially block the coronary artery and reduce the blood supply to the heart. As a result, what will happen? There is a tightness or choking with difficulty in breathing. So tightness in the breathing, difficulty in the breathing. Okay, this leads to angina. So or chest pain. Usually it lasts for a short duration of time. So simply we can say when the sufficient oxygen is not reaching the heart muscles, oxygenated blood is not reaching, then we will face this problem. So what I am telling you, listen, observe carefully. It's ischemic pain, severe pain in the heart muscles is experienced during early stage of coronary heart disease. Atherema. What is the meaning of atherema? It's a fat, cholesterol blocked in the arteries. Okay. Mainly partially blocks the coronary artery. So when the coronary artery is blocked, oxygenated blood will not reach the heart. Okay, heart muscles. So then oxygen not sufficient, not there in the sense, heart muscles will not perform the function. So that leads to a pain, what you call tightness, choking with difficulty in breathing. This leads to angina or chest pain, severe chest pain. So usually it lasts for a short duration of time. So very less time only it will be, but very dangerous. So due to oxygen insufficient or oxygenated blood is not sufficiently reaching the heart muscles, in the sense we will face this problem. It is called angina pectoris. What do you call the problem name is angina pectoris, mainly because of the atheroma, blocking of which one? The coronary arteries. Because of the blockage of which one? Coronary arteries, this problem we are getting. And especially it's not a prolonged problem, it's a short duration problem, and it is early symptom of the or early stages of coronary heart disease. We will see this angina pectoris. Which stages? Early stages of coronary heart disease. It is experienced during which one? Early stages of heart diseases. It's called angina pectoris. So chest pain. It is also another way we can call, what you call a severe, what you call chest pain, angina. What you call angina or chest pain. So what are the symptoms? Tightness in the difficulty in the breathing. Tightness, choking with the difficulty in what? Difficulty in breathing. This leads to angina and chest pain. So this is one of the disorder of which one? circulatory system. It is also problem of circulatory system. The next another important problem is myocardial infraction. What is the meaning of this? Myocardial infraction. The meaning of this is heart failure. What do you call? Heart failure. Myocardial infraction means nothing but what? Heart failure. So, observe very carefully. The prime defect in the heart failure is a decrease in cardiac muscle contractility. So, you know very well contraction and relaxation is very important. Means systole and diastole is important in the heart muscles, right? So, for supplying of the blood. But here what is happening? The heart contraction, especially the prime defect in heart failure is a decrease in cardiac muscle contractility. So contraction not there in the sense, then problem will become or not. So this is the reason for heart failure. So the Frank-Starling curve shifts downwards and towards the right such for the given in EDV. So EDV is there, in that one curve shifts downwards and towards the right such that for a given EDV. A failing heart pumps out a smaller stroke volumes than a normal healthy rate. So we will say a falling heart pumps out a smaller stroke volume than a normal healthy heart. So stroke volume will become fall, means reduce than the normal healthy heart rate. Next, when the blood supplied to the heart and weakens the muscles fibers. Next, what will happen? It is also ischemic. What will happen? The blood clot. Okay. So when the blood supply to the heart muscles of myocardium is remarkably reduced, it leads to death of the muscles. Okay. So what I am telling, when the blood supply to the heart muscle of myocardium is remarkably reduced. What is that? Blood will not supply to the heart muscles. Oxygenated blood will not supply to heart muscles. Then what will happen? It will be affects the, what do you call? When the blood supply to the heart and weakens the muscle fibers. So weakens the, which one? The muscle fibers. So reduce it to leads the death of muscle fibers. This condition is called, what do you call that condition is called? You know very well, heart attack. What do you call that condition is called? Heart attack. So observe very carefully, children. When the blood supply to the heart, or muscle or myocardium is remarkably reduced. So then what will happen? That will be leads to the one problem. That is only called, okay, that is only called heart attack. Okay, when the blood supply to the heart, okay, when the blood supply to the heart muscle and myocardium is remarkably, okay, myocardium, here I am writing myocardium, okay, myocardium remarkably reduced. Okay, what is that? Remarkably reduced. This is important. Remarkably reduced. It leads to death of a muscle. Very important. Leads to death of muscle. Okay, leads to death of a muscle fibers. This condition is called heart attack. What do you call that condition is called? Heart attack. So very dangerous. Heart attack. Okay, heart attack. Next, the blood clot of thrombus blocks the blood supply to, okay, what will happen? The blood clot or blood supply, what will happen? Will be disturbs the supply. That is also leads to one problem. Okay, so this is also leads to a big problem. That is what is called angina. That is called angina. So next, another important one. The weakens the heart muscles. The weakens the heart muscles means what will happen? That is heart diseases due to lack of oxygen supply to heart muscles. If this persists, it leads to the which one? Chest pain or angina. What is called? Chest pain. So once again I am repeating this point, children. Observe very carefully. What I am telling is, when the blood supply to the heart, when the blood supply to the heart and myocardium, okay, reduced, blood supply of the heart to the heart muscle or myocardium is remarkably reduced, it leads to death of a muscle fibers. It leads to death of muscles or muscle fibers. That is called heart attack or myocardial infarction. Next, the blood clot or thrombus blocks the blood supply to the heart and weakens the muscle fibers. Okay, clots. Clots also weakens the clots or thrombus. Okay, weakens the which one? The muscle fibers. So that is leads to one problem, that is called ischemic heart disease. What is called? Ischemic heart diseases. When the clot is there in the blood vessels, blood supply will not be properly done to the heart muscles. Then that leads to one problem, that is called ischemic heart disease. Ischemic heart disease due to lack of oxygen supply to heart muscles. Okay. If this persists, it's continuous. So oxygen is not supplying properly. It continues like this in the sense, it leads to pain or angina. Prolonged angina leads to the death of the heart muscle, resulting in heart failure. So arteries always, especially coronary arteries, should be very effective. Why? Because coronary artery only supplies the oxygenated blood. Any thrombus is there, that leads to ischemic. Ischemic heart disease due to lack of oxygen supply to the heart muscles. If this persists, it leads to chest pain or angina. Prolonged angina leads to death of the heart muscle, resulting in the heart failure. Okay, that is important. Next, rheumatoid heart disease. What is called? Rheumatoid heart diseases. What is this rheumatoid heart disease? We will see. So, you know very well, rheumatic fever is an autoimmune disease which occurs 2 to 4 weeks after throat infection. Rheumatic fever is an autoimmune disease which occurs 2 to 4 weeks after throat infection usually. Okay. A streptococcal infection, Streptococcus bacteria will be cause this problem. The antibodies developed to combat the infection causes damage to the heart. Sometimes the antibodies which are developed in that particular time, they will be affects the heart, damages the heart. Okay, damage to the heart effects includes the what will happen, you see. So developed to the combat the infection cause damage to the heart. The effects includes fibrous nodules on the mitral valve. So what will be formed? Fibrous nodules on the mitral valve. So and also it will be affects the which one? Fibrous nodules on the mitral valve, fibrosis of the connecting tissue, and accumulation of fluid in the accumulation of fluid in the pericardial activity. So because of this infection, what will happen? Fibrous nodules on the mitral valve, fibrosis of the connecting tissue, and accumulation of fluid in the pericardial activity. So that leads to rheumatoid heart diseases. Once again I am telling children, rheumatic fever is an autoimmune disease which occurs in 2 to 4 weeks after throat infection. Usually which one? A streptococcal infection. The antibodies, what will happen? Develop to combat infection causes, especially what I am telling here, antibodies. Okay, the antibodies, what they will do? They can cause damage to the heart effects. Okay, so infection cause damage to the heart. Effects includes the fibrous nodules on the which one? Mitral valve. Fibrous nodules on the which one? The mitral valve. Fibrosis of the connecting tissue and accumulation of fluid in the pericardial activity. Next, cardiopulmonary resuscitation. what is this problem? What is this method? That one we will be discussing. The cardiopulmonary resuscitation means CPR. In 1956, James Elam and Peter Suffer. James Elam and Peter Suffer, they what they done? So were the first to use mouth-to-mouth resuscitation. So CPR is a life-saving procedure. So by the mouth, we will give the air to the endangered person, means who are in the problem, patient. When a person is breathe or heartbeat, suppose any breathing problem breath is stopped or heart functioning stopped, in the sense immediately we should have to give this CPR, especially drowning cases, electric shocks and heart attacks. So what we will do, so CPR includes rescue of breath, which is achieved by mouth to mouth breathing to deliver oxygen to the victim's lungs by external chest compression. So while compressing and we are giving oxygen to the lungs of the patient, then what will happen? Circulates the blood to the vital organs. So it circulates the blood to vital organs. CPR must be performed within 4 to 6 minutes. How many minutes? 4 to 6 minutes after cessation of the breath to prevent the brain damage or death. So when the breath stopped, then immediately 4 to 6 minutes we should have to give within 4 to 6 minutes. Along with CPR, defibrillation is also done. Defibrillation means what? A brief electric shock is given to the heart to recover the function of the heart. What you call defibrillation means electric shock for functioning of the heart. So especially who are in the problems, especially drowning, electric shock, in the sense, for that people, for those victims, what we had to do, we had to give oxygen through the mouth and we had to supply oxygen to the lungs. Then because of that oxygen, the blood supply will go to the vital organs, okay, that air. And also we should have to give immediately defibrillation. Okay, what is that one? Electric shock to heart, then heart will be perform the function. So this is called defibrillation and this is called CPR. CPR means what? Cardiopulmonary resuscitation. So like this kind of techniques also will be there in this chapter. Okay, children, once again we are discussing, listen carefully. Angina pectoris is a ischemic pain in the heart muscles, is experienced during early stages of coronary heart diseases. Antheroma mainly partially block the coronary artery, reduce the blood supply to the heart. As a result, there is a tightness and choking with the difficulty in breathing. This leads to angina or chest pain. Usually it lasts for a short duration of time. So myocardial infarction, heart failure. The prime defect in the failure is a decrease in the cardiac muscle contractility. The Frank-Starling curve shift downwards and towards the right such that for a given EDV. A falling heart pumps at a smaller stroke value than a normal health rate. So stroke value will be fall. When the blood supply to the heart and the myocardium, what will happen? Reduced. So then that is the death of the muscles. That leads to heart attack. And a clot in the thrombus also causes the ischemic heart disease due to lack of oxygen supply to heart muscles. If this persists, it leads to chest pain or angina. So prolonged angina leads to death of the heart muscle, resulting in heart failure. So rheumatoid heart disease. Rheumatic fever is an autoimmune disease which occurs 2 to 4 weeks after throat infection, usually streptococcal infection. So the antibodies which are formed in that infection, they can cause damage to the heart. Effects includes the fibrous nodules on the mitral wall, fibrosis of the connecting tissue and accumulation of fluid in the pericardial activity. So these kind of problems are very dangerous because heart is most important for circulation and pumping of the blood. So when the heart is getting problem, in the sense, total systems will be fail. That leads to, okay, death of the person. So fluid in the next, cardiopulmonary resuscitation. So I suppose some people are in drowning or electric shock, or suppose any emergency condition. Suppose, okay, they are losing their breathing and heart stop, in the sense, we have to give artificial, means mouth to mouth oxygen we have to supply to the victim. Why? Because oxygen if entered in the lungs, the blood will be transferred to the vital organs, then vital organs will be function. And also defibrillation, if you give, the patient will give survive. Defibrillation means electric shock to the heart. So cardiopulmonary resuscitation, CPR, in 1956, James Elam and Peter Suffer, where the first use mouth to mouth resuscitation. Okay, that is important. So when we can use this time of emergency conditions, such as when a person breath or heartbeat has stopped. Okay, breath or heartbeat stopped. It's a life-saving procedure. Okay, especially drowning, electric shock, heart attack. CPR includes rescue of breath, which is achieved by mouth-to-mouth breathing to deliver oxygen to the victim lungs by external chest compression. So external chest compression, which helps to circulate the blood to the vital organs. So then what will happen? CPR must be performed within 4 to 6 minutes after cessation. So 4 to 6 minutes we have to, okay, after cessation of the breath to prevent brain damage or death. Along with CPR, defibrillation. What is the meaning of defibrillation? It is very, very useful. It is an electric shock. Brief electric shock is given to the heart to recover the, what you call, function of the heart. To recover the function of the heart, we will do such kind of defibrillation and what you called the CPR.